The CDC now recommends kids as young as 5 get vaccinated against COVID-19. The unanimous vote follows last weekend's announcement by the FDA to authorize kid-sized doses of Pfizer's vaccine for kids ages 5 to 11. In clinical trials, the vaccine proved 90% effective at preventing the disease and 100% effective at preventing serious illness in young children. Shots are expected to start rolling out later this week. Many parents have questions about the vaccine for kids, and we have been asking you to submit them to us over the last few days.
So now we'll put them to state health leaders and spending the next half hour getting your most pressing questions answered. Joining us from the governor's mansion, Dr. Eric France, the state's chief medical officer, as well as doctors Edwin Asturias and Brandi Freeman from Children's Hospital Colorado. I want to thank you all for joining us.
Thank you so much. And we want to start by giving you each an opportunity to give us a real quick pitch about why we should do this, like in 2 sentences or less. What you would say to a parent who is a little bit hesitant to get their child vaccinated. Dr. Asturias, we'll start with you.
Well, this is the moment that we have all been waiting for, doctors and parents, to make sure that we have a vaccine that is safe and effective for children, and that will make sure that they return to school and they are protected.
And Dr. Freeman, follow up on that if you would. How would you be talking to parents about making sure that they do want to go forth and get this vaccine?
Definitely. So each day as a pediatrician, I think about science, I think about safety, and I think about our future. And for this vaccine, the science is good. The safety is there. It's safe for children. And I really think this is what's going to help us get to the future we all want.
Okay, Dr. France, it's your turn. What do you got to say?
Well, I focus on the vaccine provides us all some peace of mind. I just had my booster, and I know my wife did. Both of us feel a lot safer because of it. And think of our young children who've been nervous about going to school, the parents who are nervous about them going to school, and maybe nervous thinking about Thanksgiving and the holidays coming up. What peace of mind to know that your children have been vaccinated and are protected and won't bring COVID to grandma or grandpa during the holiday season.
Yeah, many of us are already looking ahead to those holidays and making those plans already. Thank you. The state expects to get 171,000 pediatric doses of the vaccine early this month. And that would be enough to vaccinate about 30% of kids in that age group with 1 dose. Governor Jared Polis has said the goal is to get half of kids as young as 5 fully vaccinated by the end of January. Now, to reach that goal, the state says it's partnering with local hospitals and organizations to make those vaccines for 5 to 11-year-olds easily accessible.
Yeah, we've been talking about Children's Hospital Colorado. They say they'll be hosting clinics for kids beginning on Friday. And Rocky Mountain Hospital for Children says they'll be ready to give at least 300 doses to kids starting on Saturday. Now, those doses will be issued by appointment only. So we want to get to some of the questions we've taken in. Mara asks, we'd like to ask Dr. France this question. She says, I keep seeing more and more clinics for this weekend pre-booking. Is the state confident they will have supply for all of those appointments? Dr. France?
Yeah, we're getting doses sent to us now. We'll be getting doses every day sent to us from the CDC, 170,000 doses in this first wave. And as we get them, we move them out. We have, I think, 480 different sites that will be available, pharmacies, doctors' offices, public health agencies, schools. And as you mentioned, we'll be doing a number of these large events in partnership with a variety of organizations that attract families like museums and the zoo. I imagine over the next week, there'll be a lot of demand and people will be trying to find appointments. And I just say, thank you for your enthusiasm and excitement, and recognize more will be coming. So keep checking, and we'll be sure to get you vaccinated as soon as possible.
And we're certainly going to be following those numbers, both in those trying to get vaccinated and the supply. Many parents have already noticed appointments are filling up quickly, and Michelle from Adams County asks, are there going to be enough appointments to get our children vaccinated? And also, is Colorado possibly considering the drive-through clinics like the ones at Dick's Sporting Goods for the kids?
We are not considering the large Dick's Sporting Goods drive-through for children. We recognize that a site for children should also give the opportunity for parents to ask and have questions answered for their children. We are making these appointments available across our different organizations that we'll be partnering with. We ask that families contact their primary care providers and see if their offices will be offering. I know many of them will also be giving appointments once they receive doses in their clinics.
All right, more questions to come. Thanks, Dr. France.
So maybe you did get that appointment for your child already. What about after the shot? The kid-sized doses were shown in trials to be safe and effective, but that doesn't mean they won't have any side effects. That brings us to our next question for Dr. Brandi Freeman. And Kate from Highlands Ranch asks, given that vaccine reactions are common in adults, what vaccine reactions do you anticipate with our little ones? And is there anything we can do as parents to prepare to address those potential reactions? Dr. Freeman?
Thank you. So children can experience vaccine reactions just like adults. The symptoms are similar. So whether it's fever, body aches, definitely pain and soreness at the site. And so what you're going to want to do as a parent is just to try to manage those symptoms at home. Talk to your pediatrician about dosing for Tylenol or acetaminophen, kind of help manage the symptoms. And then I think as a parent, you're also just going to want to make sure your child is comfortable. So trying to decrease the anxiety about the poke, not shot, the poke that's coming, and just help them get through it.
Isn't that the truth? You have so many pokes in a child's life. We've tried everything, to distract them, and some things work and you figure out your own child. So we know a lot of folks will be in that position. Thank you, Dr. Freeman. We have information on where you can find those clinics on 9news.com, and you can also head to any of the websites you see on your screen for more information on vaccinations in Colorado. We'll be right back with more questions, your questions about vaccines for kids.
Good, and you, man?
Good.
through the pandemic, we certainly have noticed that communities of color lag behind in vaccination rates compared to white Coloradans, and that has been true so far in younger kids as well. Of course, now there are some doctors worried that those inequities are going to spill over into this new group, the 5 to 11-year-olds as well. Numbers from Denver Health show vaccination rates are high in white 12 to 17-year-olds, but American Indian, AAPI, Black, and Hispanic kids are all below a 60% vaccination rate. It's a topic that's of high interest to many of our Spanish-speaking viewers, and that's why we're bringing in Chris Bianchi to ask this next question in both English and Spanish. Hi, Chris.
Hey, Tom. Thanks for having us. And again, the state has had trouble reaching adults in communities of color. So when it comes to kids, many wonder how this process may be a bit different. So you can hear this next question and answer from Dr. Edwin Asturias in Spanish first, but then also repeated in English. So start things out again in Spanish. ¿Cómo pueden trabajar los líderes estatales para cerrar la brecha de vacunación entre los jóvenes en Colorado?
Bueno, a ver, lo más importante que debemos hacer, tanto los líderes del Estado como los médicos y enfermeras, es realmente trabajar con los líderes de la comunidad. Recordemos que hay líderes religiosos, hay líderes comunitarios que realmente pueden hablar con la comunidad y estimular a que los niños y los adolescentes se vacunen de mejor manera. Tenemos que llegar a ellos con mejor comunicación, con mejores mensajes y definitivamente tratar de también hacer lo que el gobernador ha hecho, tener clínicas especiales como los buses móviles que se han movido a las comunidades de color para poder llegar a todos los hispanos y así como a las personas afroamericanas y de otras minorías.
Gracias, doctor. And now we'll ask that same question in English. How will state health leaders work to close the vaccination gap among younger Coloradans?
Well, so this is an effort, as I said, of not only the government leaders, but also doctors, nurses, and everyone in the community. We need to work with the community leaders, whether they are religious leaders or community leaders, to sort of help bring the message to their communities. Communities of color as well as those minorities are waiting for those messages, and we need to try to communicate with them in their own language. We also need to provide more access to them through, for example, the initiative of the mobile clinics that have been hosted for Latino population and others that have been very effective at sort of bringing the immunization coverage for these populations to a better level.
And Dr. Asturias, again, you're going to be joining me here in just a few minutes. So if you're watching this live, then right after this is over, Dr. Asturias will join me live on the 9 News app to answer more of your questions in both English and in Spanish. If you're watching our rebroadcast, you can catch that conversation on 9news.com. We'll be right back.
Some parents are worried about when their child should get vaccinated against COVID-19, especially if their child recently had the virus. So we're taking that next question to Dr. Brandi Freeman. Alice in Denver has a daughter who recovered from a mild case about a month ago. She wants to know, is it okay for her daughter to be vaccinated this month, or should she wait? Dr. Freeman, what's your advice?
Great. Thanks so much for that question, Alice. So yes, it is okay for your daughter to be vaccinated. I'm very happy that she's okay right now. And so the idea of vaccinating her now and not waiting is that you're going to give her immune system that boost. So she has the antibodies. Should she come back in contact with COVID-19, that she's going to be ready to fight it.
I'm going to follow up with that question just because there are those that are saying, oh, my child already had it, so my child doesn't need the vaccine. They've got the antibodies, the natural antibodies. What do you say, Dr. Freeman?
So yes, they have natural immunity, but we do know that that wanes over time. And so how the vaccine is going to help you is by giving your body those extra instructions to help it remember or just memorize what it needs to do to fight COVID-19.
Yeah, we certainly see the variants change things, and people that were perfectly fully vaccinated got sick anyway. Thank you, Dr. Freeman.
Of course, the Pfizer COVID-19 vaccine for kids aged 5 to 11 will be administered in 2 doses, 21 days apart. So these kid-sized doses are a third the size of the one given to people of adult and teenage years. Doctors say the dosage size varies depending on a child's immune system. Well, those different doses can be confusing for parents with kids on the edges of those age groups, the youngest and the oldest. So we have a couple of different examples we want to ask to Dr. Eric France real quick. One comes from Amanda in Englewood, saying that the vaccine being approved for 5 to 11-year-olds, but there's another being tested for 2 to 5-year-olds. She wants to know what the difference is, saying that her 5-year-old is very small and is tempted to wait to see if the dosage is less.
Good question. I would say it's best not to wait because we live in a community now where there's a lot of COVID and children and adults are being exposed to COVID every day. The estimate right now is that 1 of every 50 Coloradans has COVID. And so the chances of a child, a family member being exposed is high. So best to grab the vaccine that's now available rather than wait for the research and the approval of a younger vaccine dose. So I would say I wouldn't wait, and I would go ahead and get vaccinated with the dose. Remember, too, that the dose we give to the 5 to 11-year-olds is 1/3 the strength of what we're using for adults. It still seems to be very effective in priming the immune system, but also seems to have fewer side effects because of that lower concentration of the vaccine.
So let's go to the other end of that age spectrum then, Dr. France. Nathan Howe from Montrose asked, what about kids who are turning 12 within a couple of months? Will they still get the child's dose for their first shot and maybe an adult dose for the second one after their birthday? Or maybe should you just wait until they're 12 so that they can get the full adult dose? If somebody's really close to that edge, on the cusp, what would you tell a parent there to do?
Again, the sooner they get vaccinated, the sooner they're protected from catching COVID. And so certainly the research shows that 12-year-olds respond well to the lower concentrated dose that we are using for this age group. Once they turn 12 and are adult, they would get the adult dose. And so there will be those unique situations where someone will be 11 and get the lower concentration and then turn 12 and get the higher concentration. I think that's fine. I think what's of prime importance is to start getting your kids vaccinated.
Just get started. All right. Thanks, Dr. France.
When the COVID vaccine first came out for adults, many women who are pregnant or breastfeeding worried that this could have an impact possibly on their baby. Many studies have since shown that getting the vaccine doesn't impact your fertility or the baby's. What about our kids? Aaron Reed from Fort Collins asked, how do we know there are no risks to children's fertility due to the vaccine? Wouldn't fertility impacts be longer term than that would need to be followed longer than the clinical trials are right now? Dr. Freeman, what do we know about that, the impact on fertility for our children?
Great. Thanks so much for that question. So what we know is that there is no indication from the trial that there's any impact on fertility. There's actually been no vaccine that we have thus far that has had an impact on fertility. And then as a pediatrician, I kind of, I guess, anecdotally know that I've taken care of a lot of babies who have been born to mothers who received the COVID-19 vaccine. So women who got pregnant and then had delivered healthy babies that I have the pleasure of taking care of every day. And so I think we can feel confident that there aren't going to be long-term effects on fertility for children with this vaccine.
Yeah, you have seen those babies this year, in fact, so that's the best part, those checkups, I'm sure. What about pregnant women getting the vaccine? What's the importance of that to you?
So for me, in particular, that age group that is being born right now, they're not eligible for the vaccine. However, their mothers are able to get the vaccine and potentially give them antibodies through science and our lovely way our bodies work. And so I think it's a really important thing that if a pregnant woman is considering getting the COVID-19 vaccine, that she should do it to protect herself and to protect her baby.
Yeah, we worry about so much about those babies in the first few months until they're fully immunized against everything. So thank you, Dr. Freeman.
We're talking a lot about what this does as far as people starting to point towards the holidays, Thanksgiving, Christmas and the like, and the end of the year. And we're going to talk a little bit about that when we come back on our town hall.
About the shot is that it's gonna keep me safe. The worst part about the shot is that it's a needle and I don't like needles.
A select group of Colorado kids like Charlie got vaccinated before the CDC signed off this week. The Brewer family signed up their kids for a vaccine trial this summer. They have 3 daughters, ages 7, 8, and 10. They got either the vaccine or placebo, just like the adults that did this trial a year ago, and they'll find out which one soon. The parents are both doctors, and they say getting their kids in a trial was just a no-brainer.
These studies are done by our colleagues who went through similar trainings and similar backgrounds, and we obviously have that education understanding of the process. And so, having that on board made it easy for us to make that decision early.
The state is planning to open at least one pediatric vaccine clinic in every single county. Pfizer's vaccine for kids ages 5 to 11 is given in 2 doses, 3 weeks apart. So even if your child got their first shot this week, it's a tight timeline to get both shots before Thanksgiving. A person is considered fully vaccinated 2 weeks after that second shot. So your kid needs to get that second shot by December 10th to be fully vaccinated by Christmas.
It will be interesting to see what happens with that. We really want to thank our guests today, left to right, Dr. Edwin Asturias from Children's Hospital Colorado, Dr. Brandi Freeman as well from Children's Hospital, and of course the state's Chief Medical Officer, Dr. Eric France, for joining us and answering your questions here today.
Yeah, so many questions that are going to lead to many more questions in the days ahead. They're going to be very busy answering those. And Chris Bianchi, also, you're continuing this conversation on the 9 News app. Tell us a little bit more about that.
Yeah, and this is really important to kind of distinguish here because, and I don't mean this necessarily in a braggy sense, but we are offering the resource here to our Spanish-speaking community that we will be answering your questions about the COVID-19 vaccine, specifically in regards to children here on the 9 News app. And this will be a 15-minute conversation entirely in Spanish. So maybe that might not concern you, but if you might know somebody who speaks Spanish, this is a really important thing to just keep in mind here, that we do have that resource available to you. We'll be starting up that conversation with Dr. Edwin Asturias here in just a few moments' time. So again, we will have that conversation in Spanish coming up in a few minutes' time on the 9 News app and over at 9news.com once that conversation is done. So again, hopefully a resource that we can really offer here to the community in just a few moments' time.
Chris, we're talking so much about what parents and families are going through, but you also tend to think of this age group, teachers very much invested in this change that is coming.
Sure.
No doubt about that, and you guys mentioned it a few minutes ago. There's no doubt when you look at the statistics at this point that the Spanish-speaking community is lagging in terms of vaccination rates, and we certainly don't want to necessarily see that carrying over here to children as well. But again, we'll have that conversation in just a few moments' time. That'll be over at 9news.com in its entirety once that is completed. So again, hopefully you'll join us. And again, if you might know somebody who speaks Spanish, that resource is available to you as well in just a few moments' time.
Doctor's appointments are hard to come by, or sometimes we put them off. This is your appointment right now. You can get the questions answered, and this all will live online as well, so people can watch it online. And, you know, it's a safe way to ask some of your questions and concerns.
And a great opportunity to just get some background as well, so you have an informed opinion to work with for any discussions you have. We appreciate you taking the time to join us for our town hall. Thanks for watching.
Buenas tardes y gracias por estar con nosotros en este encuentro comunitario sobre el coronavirus. Soy Chris Bianchi y acompañándonos hoy está el doctor Edwin Asturias, un experto en enfermedades infecciosas, pediátricas y presidente de pediatría comunitaria del Children's Hospital Colorado. Ahora, queremos hablar sobre específicamente las vacunas de COVID-19, del coronavirus para niños de 5 a 11 años. La Administración de Drogas y Alimentos ya autorizó las vacunas para niños de 5 a 11 años, dosis de solo un tercio de la cantidad administrada a adolescentes y adultos. Funcionarios de salud de Estados Unidos dieron el martes la aprobación final a la inyección de COVID-19 de tamaño infantil de Pfizer. Sabemos que hay muchas preguntas, obviamente, sobre las vacunas para niños y queremos contestarlas hoy. Entonces, quiero empezar, doctor Asturias, con esta pregunta. ¿Qué tan bien funcionan las vacunas para los niños?
Bueno, los estudios que tenemos hasta ahora han sido muy buenos. Se mostró que esta vacuna, que tiene un tercio de la dosis para niños de 5 a 11 años, tuvo una eficacia del 100% en contra de la enfermedad severa y tuvo 90% de eficacia para prevenir cualquier tipo de infección por coronavirus. Eso es un efecto muy bueno en niños y hemos visto también que la vacuna es muy segura, así que estamos ante una vacuna que creo que los padres van a sentirse cómodos de poder darle a sus hijos.
¿Qué estás diciendo que estás segura? ¿Puedes decir un poco más sobre eso, sobre la seguridad de esta vacuna?
Bueno, a ver, en los 3.800 niños que participaron en el estudio, los efectos secundarios que vimos son los mismos efectos que estamos viendo en adultos en términos de el dolor, la irritación y a veces el enrojecimiento en el sitio de la inyección. A veces los niños pueden tener un poquito de fatiga y malestar, pero no más de unos efectos transitorios que duran unas horas a tal vez un día. Así que la vacuna no mostró ningún efecto mayor por este momento, pero obviamente tenemos un sistema de vigilancia y monitoreo muy bueno en los Estados Unidos que ha permitido que en otras ocasiones, por ejemplo, para la vacuna de adultos jóvenes o adolescentes, nos ha permitido encontrar si hay algún efecto secundario que debiéramos ponerle más atención.
Sin duda sobre eso, pero ¿qué impacto más generalmente tendrá la vacuna en la población?
Bueno, recordemos que esta es la última parte que estábamos esperando, ¿no? Hay 28 millones de niños entre 5 y 11 años. Es una gran cantidad de la población y mientras no vacunáramos y protegíamos a estos niños que van a la escuela, la pandemia y el contagio iba a continuar. Entonces, es muy importante que este grupo de niños se vacune y se proteja lo antes posible, porque no solo va a hacer que los padres se sientan más cómodos para que los niños vayan a la escuela, pero también ellos se van a sentir muy cómodos de que los niños no traigan una infección a la casa. Tal vez los padres latinos que viven a veces con los abuelitos ahí o que viven con alguien que tiene alguna enfermedad donde las vacunas funcionan un poco menos, van a estar protegidos y los niños están protegidos también.
Muy importante. Ahora, ¿qué tan grande será la dosis para los niños? ¿Igual que a los adultos o un tamaño un poco más bajo?
Bueno, la cantidad de líquido va a ser la misma, es medio mililitro, pero la dosis que contiene, o sea, la concentración que tiene es un tercio de la dosis del adulto. Y eso es porque sabemos que los niños tienen un sistema de defensa un poco más fuerte y más poderoso, y eso hace que con menos cantidad de dosis podamos levantar las defensas o los anticuerpos tan bien como se levantan en los adultos con ese tercio de dosis.
¿Cuál vacuna y el tamaño de la dosis para los niños? ¿El pediatría?
Sí, cuando usted vaya a su médico o vaya a las clínicas que van a estar dándose para vacunar a sus hijos, van a ver qué edad tiene su niño y dependiendo de la edad van a escoger si es la dosis menor, que es para los niños de 5 a 11 años, o si su niño tiene, por ejemplo, 12 años y más, van a darle la dosis mayor, que es la dosis del adulto. Entonces, esa es una decisión que se va a tomar conjuntamente con su pediatra o con su proveedor de salud y que va a ser en beneficio de su hijo.
Bueno. Y si puedo preguntar, ¿tú tienes hijos y si la pondrías a ellos tras ser aprobada?
Sí, tengo 4 hijos, de ellos todos ya mayores y todos están vacunados contra el COVID-19. Y he tenido muchos amigos míos que tienen hijos menores, entre 5 y 11 años, y todos ellos, mi recomendación ha sido que sí, que se coloquen la vacuna, porque de nuevo, a pesar de que la infección de coronavirus es más suave en niños, recordemos que aún así hay uno de cada más o menos 30 niños que se hospitaliza por coronavirus, y además hay efectos secundarios que pueden ocurrir después de esta infección.
Y no sé si tú realizas algún tipo de investigación independiente sobre las vacunas, pero si no, usando los datos de estudios realizados, ¿podrías darnos tu punto de vista generalmente?
Bueno, a ver, esta vacuna no es muy diferente que las vacunas que hemos usado antes para los niños. De hecho, los efectos secundarios que estamos viendo son inclusive menores que algunas vacunas que ya utilizamos para los niños pequeños. Y recordemos que los niños responden muy bien a las vacunas. Así que esta probablemente va a ser una vacuna que va a integrarse a nuestro esquema de vacunación para los niños en el futuro, y los padres deben sentirse confiados que la investigación que se ha hecho de esta vacuna es buena y ha mostrado que la vacuna es segura y que protege contra el coronavirus.
¿Y hay algo más que quieres decir sobre las vacunas y específicamente los niños?
Bueno, recordemos que en este momento en Colorado, así como en otros estados, más o menos 1 de cada 3 infecciones por coronavirus está ocurriendo en niños. Eso es porque están regresando a la escuela y que a pesar de ponerse la mascarilla, el contagio puede continuar. Así que este es el momento que tenemos para proteger a nuestros hijos, a nuestros niños. Terminar con esta pandemia depende de que todos estemos vacunados, incluyendo los niños, y regresar a las escuelas de manera segura depende de que todos los niños en la escuela estén protegidos.
Ahora, si tienes una pregunta de dónde puedes programar una cita para la vacuna contra el coronavirus, puedes visitar 9news, el número 9news.com, donde tenemos más información en español para ayudarte. Rite Aid dijo el miércoles que espera comenzar con las vacunas pediátricas de COVID-19 en tiendas selectas a partir del sábado, el 6 de noviembre. Entonces, bueno, doctor Edwin Asturias, muchas gracias por su tiempo y por estar con nosotros esta noche. Y bueno, muchas gracias otra vez, señor.
Un gusto, y sigan protegiendo a sus hijos. Es lo más importante que podemos hacer en este momento.
Gracias y buenas noches.